Basic anatomy of the spine is essentially a number of vertebral bones that are interrelated to each other and are mobile to each other. And to aid that mobility, there are structures which we know as discs, but also a number of other ligaments and joints which then surround the spinal cord and nerves. Fortunately, the number of injuries to the spine are much less common than injuries to other parts of the skeleton. We commonly see wrist fractures and ankle fractures in sports involving snow and ice, but fortunately that doesn't happen in the spine as often, as the spine's better protected than those structures and we don't tend to fall directly to them. But unfortunately fractures do occur, and fractures to the neck or lower lumbar spine are not uncommon. Occasionally these are quite minor and don't require much intervention, but the neurology that's potentially affected below these is what we're concerned about. So when there are much more serious or high velocity injuries during sports such as skiing or ice skating, they can unfortunately damage the spinal cord or the spinal nerves. In terms of how common these injuries are, it's encouraging that in fact we don't see them as often as other injuries. But they can go unnoticed, and although the presentation of a fracture would usually be fairly obvious in that patients usually will have a lot of pain, these injuries can also be quite subtle, and damage to the soft structures around the spine, such as ligaments and the disc, can occur and aren't always associated with the time of the injury. They may present with symptoms only a few days later, where people aren't really therefore thinking that they may have injured themselves. When we do see those, I'm pleased to say most of them settle down on their own. But if symptoms do persist, it's worth not letting them go unnoticed. The spine is vulnerable during winter sports, and I think particularly as sports become more adventurous and we adapt to more off-piste skiing and potentially more adventurous mountain climbing and things like that, we do put ourselves at more risk than perhaps we had before. And it's not only skiing, snowboarding we know, but a lot of hiking in the winter in treacherous conditions can put you at risk. And anything that results in a potential fall, of course, puts you at risk of a fracture. But even fairly trivial trips and falls in the ice and presenting yourselves to the slopes can result in very simple things causing injuries. And although those injuries may not be serious, they can give you common presentations such as back pain. There always seems to be a big clash and competition between snowboarding and skiing, and I suppose they do present themselves with slightly different risks, although both of them at their extremes can be risky. Fortunately, most people aren't skiing or snowboarding at extreme levels, and therefore they'll hopefully limit the risk that they place themselves in. But we do see slightly different injuries that occur, and particularly because skiing tends to involve straight line speed and therefore tumbles with uncontrolled tumbles and therefore damage to the neck and the rest of the spine. Where snowboarding tends to be a more sideways movement, and you tend to fall either face first or backwards first, so injuries to the lower spine and the neck. There's no doubt that over the last few years, with the advent of skiing helmets, which have become essentially the norm on the slopes, they've diminished the incidence of associated head injuries, which is very helpful. But the rest of the spine is still put at risk. When you're advising people to prevent injury, a lot of what you're trying to advise them about is the normal type of thing that we do for any sport, which is warming up, trying to stretch before you get onto the slopes. It's very easy to get onto the slopes and glide into your first run because it's a simple, easy thing to do, but then you're not expecting something to go wrong a little later down the line. So warming up in the beginning is useful. It prevents those soft tissue type injuries that we often see in the back. And then I suppose we've got to be sensible about what you do and limit yourself to the level of skiing or snowboarding that is appropriate for your skill level. I wouldn't tell people not to go off-piste, but one's got to be cautious and follow sensible guidelines about where you ski and what ski areas to follow. And there's no doubt that doing things with an experienced local or with a guide can reduce the chances of you getting into any trouble, not only fractures and injuries. In terms of the symptoms that are going to be a warning sign you may have done damage, it's fortunate that serious injuries are likely to be pretty easily noticed. It's unlikely that a trivial accident with very little symptoms in the beginning is going to result in serious injury. But they can occur, and I think if somebody has injured themselves and felt pain at the time of a fall, which hasn't simply settled down straight away, it's sensible to have it at least checked out. And even if that means coming off the slopes and going to have it looked at in the medical centre, just to be cautious that you haven't done significant injury, and most serious injuries will be picked up easily. But in people that have got symptoms despite what they feel is a fairly trivial fall, and those symptoms persist beyond the use of just simple painkillers like ibuprofen and paracetamol, it's worth having them looked out and checked it out in the medical centre, or at least when you return home. And certainly those people that present with pain in their back after a fall, or pain in their neck after a fall, or a trivial trip, that have symptoms going down their arms and legs, I think those need to be looked at early. I'd always be encouraging that people should go out and be active in the winter. We mustn't also forget that although it's winter for us here, a lot of people are taking their opportunities to have summer holidays in other parts of the world. And so there are a whole host of activities that people should be engaging in now, because overwhelmingly sport is good for you. But I suppose people need to be sensible and follow decent advice locally. Always wear safety equipment if it's available, and be cautious, but absolutely go out there and have a good time.